Well, well, thank you. It's very exciting to be here. And what I'm going to try and do today is to give a bit of a brisk overview of a very complex field. So you guys are smart, so I'll skip every third word and you can fill in the blanks. What I'd like to do is just try and give you a feeling for the momentum we have in healthcare and how it's integrating a number of the technologies we have, AI and biosensing and other technologies, and to give you some pointers, if you're interested in the field, where to jump in. So one of my major concerns, and we all should be concerned about this, if we look at the demographics for aging, we're going to be top-heavy very soon. Family sizes are getting smaller. We're all living so much longer than before, and the data is such that we may have an economic crisis more profound than climate change in the near future. So something to design for and work on now is to be ready for this age-related crisis in healthcare. And, you know, as we all live longer, we will have a higher proportion of the diseases that we have been struggling to get on top of for years related to cognitive function, physical function, etc. We're in a position to do that, but we need to start now. And it's not just the diseases associated with longer lifestyles and aging. It's also that our culture has put us in a position to have some really challenging problems such as anxiety, depression, mobility, and eating disorders. We need to work together to get on top of those. Fortunately, we have some ways of doing that. And I love the quote by William Gibson, that the future is already here, it's just unevenly distributed. That's the opportunity for us, is to take the research findings that are done in the academic arenas, the work that many of you are doing, get it out there, translate it, and get it into use. And fortunately enough, XR platforms are giving us a key way of doing that. And again, I'll try and give you a brief overview of what's going on in the field. Now, I do have a number of academic groups that are my home base for my work, but because we do need to translate, move things out of the research laboratories, I've also had the opportunity to work with a number of very exciting medical product companies, healthcare networks, investment groups, etc. I think we need to get beyond that concept that we need to be ultra careful about just being in our space and being focused. I don't think now is the time to focus. We need to do very good, very precise work, but we also really need to work hard to scale right now. And that means getting the hybrid vigor that can come out of meetings and conferences like this. So as you all know, we're in the middle of a digital health revolution. The patient is becoming the center of focus instead of the clinic or the hospital. We're leveraging the intervention of wearable sensor technologies and the amazing information we can get personally and also clinically from those sensors. We're also seeing new ways of interpreting that information, being to use voice as a biomarker for anxiety, depression, looking at eye gaze data as a way of indexing attention and cognitive load, ways of getting brain health data just from our utilization of a cell phone. This combined with the trend right now, which is to look at combination therapies, where it's not just a prescription medication or a medical device, but that used in combination with a digital health app allows us to do incremental work and also close the feedback loop and collect data that can improve the use of these devices. And, you know, with the promulgation of sensors, we can leverage that as part of improving healthcare. The other trend is being able to understand more about what goes on inside the body without having to go inside the body, to use some of the external sensors that can look at information that we collect from our sweat, for example, to measure hormones, measure other metabolic parameters, not just glucose. Then, of course, what was going on right now with AI can allow us to do predictive modeling and predict when there's going to be a problem, modeling an answer to that problem. And of course, we've talked a lot today about digital twins. That concept is migrating into healthcare in a very vigorous way. What we need to keep in mind, though, is it's not just the individual. It's not just our data. It's the data of our families, of the people we spend time with, our communities, the towns we're in. That data also needs to be put into these models to allow us to understand the dynamic forces that are shaping us and look at phenomics as well as genomics and every other aspect of the data we can collect to put it into these very rich systems to help us improve. But that data source is just static unless we find a way to use it as a therapeutic or diagnostic value. And that's what I'll be talking about next. So we have seen a shift in the medical landscape. The tech titans are moving into healthcare. We've seen that with almost all of the large technology companies are looking at healthcare as their next opportunity. Fortunately, because of COVID, there's been changes in our attitudes about regulation, and also telemedicine is much more acceptable. And also now we have less of a stigma about mental health, fortunately. So it allows us to come up with new interventions, new solutions, and promulgate them into areas that previously people would have resisted. So I want to talk for a brief moment about the field of effective computing. It's going to be a very important part of both technology of the future and in particular for healthcare. I think what we can learn from this field will revolutionize the field of psychiatry, psychology, and coaching. We'll be seeing how we can take this data from wearable sensors, how we can take the information that we as individuals are transmitting to each other as social animals, our movements, our voice tones, our facial expressions, what we do tells us a lot about our cognitive status and our emotional status dynamically. And as the tech companies start looking at AR systems, VR systems, immersive systems as part of the interface that we have with each other, as we have with technology, as we have with the wider world, that information is part of that transmission. If we want to optimize the user interface between people and technology, we will start looking at those very honest signals about our cognitive state and our emotional state. So this, again, will be data that will be part of our world moving forward, that will be collected to optimize the interface that we have with each other and with technology, but it can also be used very importantly for healthcare. So just one example, I see that Lawrence is here from the company HarvardXR. I love what they're doing in terms of being able to collect eye data, use SDKs and other systems to collect from a cell phone, from an AR system, from a VR system, from a laptop, data about fatigue, cognitive load, other parameters. One thing that very impressed me was being able to do predictive modeling and understand early signs of Parkinson's and perhaps medication management just based on eye gaze data. Just one example of how data can be used dynamically as part of a therapeutic process. Information on our smartphones, how fast we're typing, what we're doing, where we're going. That data also tells us a lot about mood and behavior. And then also voice analytics can be used a bit. So bringing this back to the field of XR, I feel we're on the cusp of move beyond the early adopter stage. There's been many examples of how XR systems can be and are being used therapeutically, but we've certainly hit that threshold of the early adopters have brought it forward. But we're at that point where we're poised, because of the power of the analytics that are coming forward, to move beyond that early adopter stage. And I'll try and just give some very brief examples in the time I have left. Almost every area of clinical care has had some significant work being done both on the academic level and at the early stage startup level. And now finally, the larger medical device, pharmaceutical companies, and healthcare networks are moving down to embrace some of the work that these early stage startups have done to move things forward. So we'll see the full stack of healthcare is being impacted by immersive systems, from testing, interventions, better ways of facilitating adherence, ways to reach underserved populations, ways to function preventatively. And there's many ways why VR is impactful, and just a few of them are listed out there. We can use AR systems by leveraging the brain's reward feedback system to facilitate neuroplastic changes. We can shorten the reward feedback loop by showing people progress or maybe even exaggerating their progress so they're motivated to keep doing the often called difficult things we need to do in healthcare. We can leverage the brain's neuron systems to understand ourselves better and other people, again, as part of a therapeutic process. And we can create experiences that are motivating, challenging, and impactful. So nicely enough, the way AR systems, XR systems, VR systems are designed, they do provide a context for us to leverage the way people are motivated, the way people learn. And we take what our friends in the gaming industry, the movie industry, the entertainment industry, the gambling industry know about promoting adherence and put this as a layer on top of our healthcare systems. Often fantastic results can be achieved in healthcare if people adhere to what they need to do, to take the drugs they need to take, or pay attention and exercise, or eat the right nutrition. It's very difficult to do. And that is one of the biggest challenges in healthcare today. Fortunately, with XR systems, we have a way to create an experience, close that feedback loop, and help people adhere to what they need to do to stay healthy. And I'm really excited about the possibility of putting a layer of storytelling on top of the healthcare experience. Heretofore, we've had very discrete experiences where you might be provided with a sheet of Xerox papers of what you need to do, and we'll see you in a month. But now we have new methods to create an experience that motivates people. I see that my time is declining, so I'll speed up a little bit. I'm particularly excited because I got involved in the XR arena back in the very early days. And you can only imagine how exciting it is for me to be at this meeting with you, to see where things are moving forward so passionately and so thoroughly, crossing that threshold. But again, we have ways of doing more objective training where we can create an experience, slow down, adjust the speed of the learning process for a precision learning approach for all aspects of training and learning in the clinical arena, including learning how to do the very difficult conversations we have to deliver very uncomfortable news to an individual that can be practiced offline so you get it right. And we're learning now to do better objective assessments by using the ability to capture movement, be able to create an experience for an individual. We can challenge an individual using a culturally appropriate or age-appropriate experience and see how people react. There's systems that are being developed that not just capture our cognitive and our emotional stance, but how that combines with how we move and how we can build a model for the individual of how they respond to an environment. And we have starting to build a library of different evocative experiences that create different mood states. So between laboratory comparisons, between research groups can occur using a library of standardized evocative environments. I'm excited by the work, just as one example of how this can go, by my colleague at Stanford, Lee Williams, where she takes a precision approach at understanding how to address a mental health issue, looking at imaging, looking at metabolics, looking at genetics, and challenging the individual with a VR experience, understanding how they react, and using that to identify what subtype of depression they may have and what the most appropriate treatment is. This then can be reflected in some of the works of some of the emerging pharmaceutical companies that then are able to use that data to come up with, identify the responders, the non-responders, and identify which medication might be appropriate for the individual. So instead of saying, try this, see how it does, let us know in 2 weeks how you're feeling, and try and give us some subjective statement about how you're feeling, we now have objective ways to identify who is likely to be a responder and how they're doing right from the get-go. So in addition to better assessments, we have new ways of doing interventions using immersive experiences, physical therapy, occupational therapy. We can do pre-surgical planning in a very robust way to design an operation in advance and have patients be part of the decision-making as part of their surgical procedure. So many amazing interventions in the field of mental health. Almost every aspect of psychiatric and psychological care, we've had amazing interventions that can create an experience, teach people the resilient skills they might need to deal with a trauma or a uncomfortable situation, learn how to reverse that, skills they might need to deal with cravings and addictions, how to address attention deficit disorder and autism spectrum disorder by being able to reflect back in the individual's perspective through perspective taking. And I'm so impressed by our colleagues at the Veterans Health Administration who have scaled to almost every Veterans Health hospital with more than 30 different clinical indications using XR technology. And Mark Zhang is here as a representative from that group. So we have new ways of facilitating adherence. What we've seen with cell phone apps in psychiatry is very poor adherence. People use them for a little while and drop off. We don't see that with XR systems. We have new tools. For example, one of the projects we did at the Stanford Virtual Human Interaction Lab is to create an avatar of your future self. You can have a dialogue with your future self, and your future self can encourage you to do the right thing. And your future self can sense what you've been up to, give you a phone call if you go into a bar when you've been trying to cut back on the amount of alcohol you drink. So again, new tools to leverage AI, biosensing, and AR, VR to come up with better ways to help us do what we want to do. And again, I think because we can now put the layer of storytelling on top of these experiences, new ways to get people to participate in their healthcare in a preventative manner. So what are the constraints? What are the gating steps to adoption? Well, most of the work we've done, although it's been profound and encouraging and showing us the right pathways, we've had only small, limited size clinical trials. Also, the technology keeps changing. So something we might do in a research study, by the time it's published and brought out, that technology is no longer available. We've moved on to something else. So we do need to stabilize and to come up with some ways of looking at the mechanics behind the interventions, because that will persist across the different technology platforms. We're, of course, dealing with the fact that in healthcare, VR is still viewed as a bit of an exotic platform. And I don't think we've done as good a job as we need to do to understand the ecology of the healthcare system that we're bringing technology into. We can be great at clinical care or technology, but unless we're also very good at understanding the business of healthcare, our products won't go anyplace. We also have a big interoperability issue. If you have 2 or more comorbid conditions, mobility disorder, chronic pain, mental health issues, and you have to use 3 different headsets with 4 different user interfaces, it's a challenge. So we need to get better with data structures and harmony of different interfaces. Again, the Veterans Health Administration is working to address this. To summarize, I think we're poised to move from the early adopter stage into the broader use of healthcare. I think it will take the larger healthcare groups, the medical device, the pharma companies, the healthcare networks, to take what's been done by the early stage development companies and move it forward, but we're ready for that. Nicely enough, I think many of the things that we are working on and have proven their efficacy will help us address that issue of senior aging. And I think we are also now designing to make the clinician's role be more of an informatics profession in addition to human touch. We have to design, though, the right way to make sure we're not overburdened by all the sensors and systems that we're developing. So we need to do a better job of designing for being unobtrusive with our measurement systems. And there's many, if you're interested in this field, there's many groups to follow up on. The AMXRA, Mark Zhang is here as the founder of that organization. The International Virtual Reality Health Association has annual meetings, both here and in Europe. The Journal of Medical Extended Reality is up and running. And I just had a wonderful experience at the Virtual Medicine Conference at Cedars-Sinai. So if you're interested, there's many touch points. But again, I want to emphasize, we need to be very careful how we do this. I love the book, The Battle for Your Brain, because this data can be so profound for understanding our emotional state and our cognitive state. It's also very precious. So as we design systems, we have to design for privacy first. That's it. Thank you very much.
Sir.